Hey guys, my name's Sam and welcome to Paramedic. In this week's video, we have Wes, who is the owner of XShear. He is also a flight nurse out in Michigan. So today we're going to be talking about his career path, how he got to where he is, and hopefully give you guys an idea if that's something you want to do. Wes, thanks for coming out. I really appreciate getting the chance to talk to you about this. It's kind of a different side to medicine, the nursing career, and I've had a lot of questions of, do I want to go paramedic, do I want to go nurse? And of course, I tell them to go paramedic every single time. But, just having that other perspective, I think, is super valuable. So can you kind of tell me what your background is and what your story is?
Yeah, thanks for having me. I'm really glad to be here. The whole paramedic nurse thing, it goes way back, and I have the advantage of having both sides of that story. But I started out when I was about 18. I didn't have a lot of exposure to emergency medicine. My brother was a firefighter, EMT. He's about 11 years older than me, and so I remember riding around with him a little and being around the station and stuff with him. But I kind of wanted to do something in my community, and so I signed up for a volunteer basic EMS service in rural Michigan. And they sent me to EMT school at a local community college, and so I started doing EMT basic and really enjoyed it. Super green, didn't know anything about anything. YouTube wasn't the thing back then, so I didn't really even have much to watch. So that got me started in EMT basic and working on a volunteer rig. Did 2 semesters there, got my EMT license, and was having a lot of fun with my classmates and my instructor, and now everybody there really enjoyed that. So I went into EMT specialist, did that through the summer, and then my community college did their first ever paramedic program, and so I went right into that. And just kind of one thing to another, did the paramedic school. And when my paramedic school finished, the same community college, they were trying to really get their kind of emergency service thing going, and they did a paramedic to RN, which are not too common. A lot of people look for them and ask about it. I know a lot of medics, if they're considering doing something different, looking at a career change, will look at the paramedic to RN thing, and now there's a few online, I guess, and there's still a smattering of programs across the country, but that worked really well for me. So basically the way my program worked, we did a transition class over the summer. So everything that is typically the first 2 semesters of nursing school, you have intro to pharmacology, med-surg 1, all this kind of stuff is a 6-week block. Okay. And so we did that, OB, pharm, all that stuff real quick. And then we joined the 3rd semester nursing students in the fall, 3rd, 4th semester, and then had my associates in nursing basically 18 months after I started the program. Didn't really set out to be a nurse when I started, but I liked what I saw in emergency nursing. At that time in the area I was working, I discovered that if you wanted to support a family as a paramedic, you were going to do it with a lot of overtime. And unfortunately, that's the reality in a lot of places still, but it's gotten better since then. This was back in 2007 that I became a medic. And so the nursing route was a little bit better for that. So fresh out of school, I went to Texas, got a job in Brownsville, Texas at an emergency department there. Basically because it was kind of the job crash of 08, 09, and they were looking for ER nurses and moved me down there, and I was single and up for an adventure, so it was a good time. Right on the border, right on the Gulf of Mexico. It was a really good learning experience. My paramedic background definitely helped. I'd been a medic for a couple of years at that time, and EMT for almost 5 years, and so when you get thrown in kind of a really busy environment like that without a lot of experience as a nurse, I relied on that background as an EMT and a paramedic to make sure that at least I didn't kill anybody or could recognize my sick patients. So that helped. I was down there for a couple years, came back to Michigan, got a job at a level 1 trauma center, peds trauma center, burn center in Michigan. That was a really great place to work. Worked there almost 5 years. Before I was able to get my job in HIMSS, helicopter EMS, where I am now. So it was through my ER job that I created XShear, and that's not what this is about, but basically, I was looking for a better trauma shear tool and tried different ones. And when I was working in the ER, we released that back in 2016. And then shortly after that, I got a job at Air Care where I work now. So we talked a little bit before. You were talking about kind of the career path into flight nursing. There's the paramedic side, there's a nursing side. It depends on the organization you work for, how they function. But at my organization, we actually run dual nurse medics. And so it's unique. There's not too many in the country that do that. There are several, but I love it because I get to kind of sit in both seats. We do the medications, we do the airway, everything we operate in both those roles. Traditionally, the nurse would take more of the ICU side, so they're taking care of the meds and the infusions, maybe the assessment, some of that stuff, and then the flight paramedic would take airway and more of that side. More try to stay a little bit more within the roles and the experiences of the two job categories.
So if you didn't do the bridge program, if you were just going from nothing to your RN, your associates in nursing, how long would that generally take?
If you don't have prereqs that transfer over from your paramedics, so say you have just a certificate in paramedicine from eons ago, it's usually 2 years for an associate's degree. So you're going to have a solid, probably more than that. You're going to have at least 3 semesters of prerequisites, maybe 4. And then you'll have the nursing program, which is almost always 2 years. And that's for an associate's degree, which is pretty much a good place to start in most states. I have my bachelor's now. I don't have anything against, bachelor's prepared nurses. It's a great way to go. But if you're trying to feed your family, you can get that associate's degree, get started, maybe make a little bit more money, and then work on your BSN online.
I know the hospital I used to work with in Iowa used to have, they'd hire you as an RN, but then in like a 3-year term, they required you to get your BSN. But the nice thing about that is that then they'd pay those nurses to do it. So you'd pay for your associates, and then the hospital system would just pay for everything else, which seemed like a good way to go.
That's pretty common. The hospital I worked at was that way as well. You had to at least be enrolled in a program within so many years. There was some tuition reimbursement if you were full-time. A lot of organizations want that. I think it helps with magnet status and various hospital verification, and just, it promotes kind of ongoing education and stuff for their staff. So
where do you see the big difference between, paramedic and nursing? Because I feel like a lot of times the two professions are kind of compared side by side because it's similar levels of training and it's similar scopes of practice when you look at it. But, I think there's a lot of people kind of trying to decide which one they're doing. So how would you characterize the difference between the two, having both those educational backgrounds?
That's a good question. And it's interesting because you see some degree of, I don't want to say animosity, but it is sometimes. Yeah. And sometimes it's a friendly rivalry, and other times it's less friendly, or it's somewhat passive aggressive. Having done both, there is certainly some differences. And if you've only done one, I can see how it's somewhat challenging to completely understand the other one. So for a nurse that finished nursing school, maybe worked in med surg or ICU for a few years, came down to ER, to understand the environment that pre-hospital's operating in, where they're stabilizing this patient, just trying to, get an IV while they're bumping down the road and get the best, couple drugs in they can or whatever in the amount of time they have, call and report, all the different things they have going on for a potentially brief amount of time, and then they bring them in. And it's challenging maybe for them to understand some of the barriers and some of the situations that pre-hospital deals with. And I think that's partly where some of those attitudes or misunderstandings, some of that comes from. And then EMS, if you walk in and you see everybody at the nurse's station charting and nobody looks at you as you're wheeling into the room or whatever, like it's, I've seen both sides of that. I definitely have, and I understand some of that. But in reality, the scopes are pretty similar. EMS is not cowboys out there doing whatever they want. They're driven by a set of protocols. They have basically their orders have already been given, and if you get this, you do this, through their protocols. And with nursing, you generally have a physician there writing those orders, and not always. Sometimes we'll put protocols in. And when I worked in the hospital, I tried to maintain a really good rapport with the docs, and we'd work together. And if you had a patient that needed something, I didn't feel like I was hindered by the physicians from caring for the patient. You would, reach out to them. They'd put an order in. You'd suggest something if you felt like your patient needed something. You could advocate for them. It was a great collaboration. I never felt like being a nurse, I was, less free to provide patient care or to initiate, advocate, take care of my patients than as a paramedic. I always really felt like it went well in the hospital working together with the docs, and I've always enjoyed that relationship, both pre-hospital and in the hospital.
So who would you, like somebody going into the medical field, you're looking for something to do, and you want to be a helper, you want to be in that kind of environment. So comparing like an emergency nurse to a paramedic at this point, what kind of a person would you say, I think you should probably go into nursing, as opposed to, I think paramedicine is the way to go for you? Or would you just suggest one over the other all the time?
I wouldn't suggest one over the other all the time. I do think nursing, you have a bit more opportunity to go different places if something doesn't work out. It gives you a lot of ability to go into critical care, to go into ER if you want to go work in, outpatient surgery and have your 9 to 5, no holidays, no weekends. There's all these different things you can kind of do with it, and you can start in the kind of fast-paced and then move your way to something else if you want later in your career path. And so that's pretty nice. EMS doesn't always offer that opportunity as much. There's certainly folks out there that have jobs in EMS, be it, doing health insurance or life insurance exams or things like that, where you can get a different gig that takes you off the road. You're not lifting patients and doing things like that. As far as like personality types or things like that, probably the pre-hospital crowd is a bit rougher. Your patient care is going to be a little bit more raw. You're dealing with the motor vehicle scenes and all that kind of stuff. Whereas in the ER, it's a lot of the same thing, but it's a bit more structured and a bit more controlled. And so I guess if you really don't know which way to go, try to understand both. Look at, how important is income to you, how important is working 8 to 12 versus 24s, or all the different things, what the agencies do in your area. And then spend some time with them. You can usually job shadow a nurse. You can usually job shadow on an ambulance. Talk to folks. I'm always a big fan of getting to know the people a little bit if you can.
I guess I've known, like in my career, every time that I go to do something, and any like major advancement I've made in my career hasn't really been because of my qualifications. My qualifications get me in the door, but then having those relationships with people and the right person giving you that endorsement into it has been the biggest thing for me, of just knowing the right people and making those connections. And I think generally just not being an asshole in your daily life. You kind of talked about like the animosity between nurses and paramedics, and I worked in a hospital-based system. I worked with a lot of nurses, and we definitely had our times we poked fun at each other and stuff. But I think the thing is that they're two different professions, and for me, I guess I've noticed that it's two different job sets, even though they might deal with the same patient. You have the paramedic, and you can stop me if I'm saying anything wrong with it or that you don't see it from that perspective, but you have EMS in the field, you have the patient, and it's stabilized, and it's moving, and it sees something, do something, and you're it. There's no other help except for helicopter periodically, but when you get, and you kind of just do what you can, what you have, and then you get to the hospital, and the nursing staff takes over, and you have all of these specialists and specialty units and tests, and they can take a more nuanced approach. And while there's not quite as much autonomy in that space, there's a lot more depth to everything you're doing. And you get that follow-up, where in EMS, it's a lot of times it's drop them off at the door. I hope for the best, and we're going to take off and get a sandwich from a break room on the way out. But that's like, for me, that's been the biggest thing, and just understanding that they're different jobs and not comparing the two a ton. Like we're comparing them right now, but not in a jealous way. Now, I will say that I've found EMS, I think nursing is a very old career. You know, it's something that's been going on for a while, and in the last 20 years has really kind of found its feet as a profession and as a really specialized skill set for people, whereas EMS has about half the time or quarter of the time of nursing does. So I agree with you. I think that you can definitely make more in nursing, but in my experience, you know, I've made a good living off it, and I found that a lot more places are starting to up that.
No, in the 15 years I've been in the business, it's changed significantly in my area, you know, as far as, you know, other areas, or if you're fire-based or all these different things, there's definitely, so I don't think money is the bottom line. I think kind of understand what you want to go into it for a little bit. The flexibility, you can bridge from one to another. You know, you can go work in EMS and go on and become a physician or different things like that. And I think I have never regretted for a minute the foundation of EMS. I think to become even a medical first responder or an EMT basic and to spend some time on an ambulance is a great life skill, no matter what you do with yourself. So I would never discourage someone from that. You know, if it was a family member, I'd be like, yeah, get ready for some rough crowds. You know, there's a type that we've all met, and it's becoming less. It's becoming more professional. But it takes a certain type of person to do that. Most of us are a little bit, you know, ADD and a little bit trauma junkie or whatever terms you want to call it. Like I always say enjoy is the wrong word, but that's what we train for. And so when you get in those situations, it's something that we like to do. And so either you like that or you don't. And if that's something that you think you would do well at, it's not necessarily the reason to get into it. Most people hopefully get into it wanting to help people. For either profession, I always tell people you have to want to take care of people, to make yourself as good as you can be, to always be learning, and have something more than just, I want a paycheck, and it seems like, you know, EMS is a good way because you work 24 and you can sleep 6 hours if you're in a less busy system. Or nursing, it's an associate's degree that can, you know, make you X amount of money. You have to want it. And nursing is very challenging. I've met, you know, salty old medics that went back to nursing school and was like, what is this? You know, that was very challenging. Paramedic school can also be very, very challenging, but it's very different. And the school is very different. You know, I will say that. Paramedic school, you know, like you get in and you do a little A&P, or not, I was thinking EMT basic school, little A&P, and then you're like backboarding people and holding them upside down and like super hands-on, really lends itself to the that kind of ADD or that kind of personality type that likes the hands-on learning, is ready to do stuff. Paramedic, obviously, you get more into pharmacology and cardiology and all that kind of stuff, which I really enjoyed, you know, all that as well. But nursing, for the first little bit, you're learning these detailed assessments. And old school nursing, because it is a very traditional career path, you have these nursing assessments and you know, even things like how you make a bed and all these things, that how you roll a patient and wound care and dressing changes and stuff that is very important and very important to be done right, but to an EMS mind can be challenging. So that was some of the stuff I never really stopped learning from when I started EMT basic until I was a nurse. Was basically a 5-year path that I was in school the whole time. So it wasn't as challenging for me. But if you're a more seasoned EMS provider looking to go back to nursing school, you just have to be ready to kind of deal with that and put up with a little bit of stuff that you might not see the value in order to get through the program.
Yeah, dropping your ego. I've noticed a lot of people like going back to nursing school, they're unable to kind of drop that. You know, I was intubating in the field yesterday. I don't need to know how to make a bed, but you know, I'll be honest, I can't even make my own bed.
Right.
So like that would be a skill I definitely need to learn.
Right.
How about HEMS specifically?
Yeah.
So if you're either, and I know you've probably been involved in the hiring process of the paramedic side, or at least know of it in that regard. So if you were looking either from a nurse or a paramedic perspective, and that was your goal, is to get onto a helicopter, what could somebody do to prepare themselves in that realm?
You've alluded to a couple things earlier. You talked about kind of the continued learning. You talked about just being a nice person and looking for those opportunities and building those relationships. I think that's really important. I think doing the job you have now as well as you possibly can, never stop learning, make sure that you're engaging with people, try to get to know people that are in the whatever job you want to do. That's just kind of good practice. Network with them, either using tools online, but really face-to-face. Like if you know somebody in your facility is working with HIMSS, maybe they cross and work in the ER too, get to know them a little bit, ask them some questions, interact a little bit. Helicopter EMS is very tight-knit, close crews, maybe a little bit too much sometimes, but you really collaborate as a team. When you're in the back of an ambulance, it's very important, but usually kind of the paramedic takes care of them while you're in the way to the hospital. In the back of a helicopter, you always have the two providers. You're back and forth. That paramedic nursing, if you're a nurse medic crew, it's really important you don't have any of that left. Like you've got to be able to operate seamlessly and work back and forth. So I think it's really, really important. Like you can't understate the importance of just being a team-oriented, check your ego, know your own kind of personality, your own limitations, and to operate as a team. My medical director during my hiring interview, I was super nervous studying up on all my drugs and drips and all this kind of stuff. And there was that, usual conversations about that stuff. But at one point he was like, we can teach, if you're willing to learn, we can teach you any of the critical care stuff that you might be limited. What we need to know is how you're going to function as part of this team and how you operate under pressure and stuff like that. So be self-aware, know how you operate in that capacity. Other than that, I always tell people to try to network. I recommend teaching some classes. I think it looks good on a resume and it's a really good experience, even if it's, whatever level you're at. It can be an American Heart, CPR class, ACLS, PALS. I teach for the ENA as a nurse. I teach their TNCC and ENPC, which are nursing classes for emergency nurses. But that just, it looks really good on a resume, but it also gives you a lot of interaction. And those classes are changing. I know PALS and ACLS kind of changed their format. There's less face time in those classes than there used to be. But it used to be, everybody in the system comes through those classes, and it's a good way to collaborate with, maybe the people that are going to be hiring you or going to be in on your interviews or things like that. An advanced certification is great. If you go into it, some of them require it. So FPC, CFRN, CEN if you're an ER nurse, what are the critical care, EMT, some of the transport ones. All of those, they're good. They're great just to learn. It makes you get into a book. It makes you work on advancing your education. But then it also really helps on a resume, just things to set you apart. And you have to be a little bit lucky. There's just not that many jobs out there. And so that's where if you know the people ahead of time, if you get some good references, it goes back to being a nice person. But if you work with folks and they can vouch for you and you build a list of references that are maybe mutually known by where you're going. So if you have, docs and nurses as your references that are going to be known by the people that are interviewing you, that really helps too. That's something I tried to do when I got my job. I had, great people that were willing to vouch for me, and they were all kind of mutual colleagues of the folks that were doing my interviews. So I think that helped a lot too.
You said something earlier that I thought was interesting and something that I've seen a lot of providers. So we work in our 911 system, we have EMTs, paramedics. And there's this misconception that the schooling makes the provider. And what I found, and you alluded to it, was that if you're a bad EMT, you're going to be a bad paramedic. Yeah. If you're a bad CNA, you're going to be a bad nurse. And I think there's this pride or the lack of pride in these lower certifications, the more basic certifications. And they think, well, I'm smarter than this. I can go on. I'm going to do more. And then they get to that point and they don't have the fundamentals down. They don't have the base because they don't, in like EMT to paramedic, you know this, they don't reteach you the basics. They assume you're already a competent EMT and you know all these things. And if you don't, yeah, you're learning a drip, but you don't understand when that's going to be applied or what kind of patient it's going to be.
Right.
So
or you don't know how to do the assessment to determine if you need it. Or yeah, I place a tremendous amount of value on the continuum of the patient care. I genuinely try to appreciate, the housekeeping and ER techs that I worked with, and CRNAs and the EMT basic, MFR firefighters. I worked for a basic service where we had an MFR and an EMT basic typically when I was starting out, or a firefighter jumps in the ambulance to drive, and the MFR and the basic are in the back helping with the patient, and we ALS intercept on the way in. So that's kind of where it came from, and I really, really appreciate the scope, and I don't think anybody ever needs to feel like they're inadequate because of their current level. I think take pride in where you're at, function to the best of your ability, don't go out of scope. You can learn all you can, but stay in scope, know your limitations, because that's a whole nother thing. If you're trying to act as a paramedic when you're not. But take pride in where you're at, learn it, master it to the best of your ability. And if you do that at every level, you're going to be recognized and you're going to be great, because a lot of people don't. Complacency sets in. You just don't want to work that hard, whatever. But yeah, you're exactly right. If you care enough to be great as a basic, you're going to be a good medic and you're going to do well, and you'll be recognized because, anytime you function to the best of your ability, people will notice.
Tell me about what you're doing with XShear and kind of what motivated you to start that. For those of you that might not have seen the video, I've actually did a review on these quite a while back, and I actually bought these because I was looking for something a little bit lighter than the Leatherman. So what kind of prompted you to start this company, and what are you doing with it now? Yeah,
so I was working in a level 1 trauma center when we kind of came up with the idea, and Weeb is my father-in-law who's an experienced product designer. I wanted to kind of collaborate with him. I sort of had an idea of running a side business and building something else. And I decided the best way to do that was just to look for something that I wanted to use. I think most of the time the best innovation comes out of a need that you understand. If someone's looking to build or to educate or anything like that, pick something that you feel like you wish you had or you wish you knew better. And so that's where the idea came from. I was carrying the Raptors, didn't like having to clean them, didn't like how heavy they were. They weren't really comfortable to use. I didn't need all the extra capabilities as an ER nurse, wasn't using that. And so that's where the idea of the XShear was born, just clean, simple, good scissors. And so that's what we're doing now. I still work full-time as a flight nurse, love it, not going anywhere. It's a great job, but XShear has kind of continued to grow, and we have a lot of folks that use them that really like them, so we're really blessed, and we enjoy providing the product. I enjoy taking care of the customers that reach out, and warranty work or anything like that. It's fun kind of taking care of the profession that I love. I love EMS, and I love emergency healthcare, and so it's just a simple thing. It's just a trauma shear, but when you're trying to cut someone out of clothing and you have and you have one that's not working and someone gives you one that works great, it's a big deal. And so it's been fun. It's been a fun brand to grow. And, I appreciate folks like you that kind of early on gave us some kind words. And I like to support the community however I can.
Absolutely. So that's about all we have for this video today. If you guys have any questions, I haven't talked to him about it, but I'm going to volunteer Wes. He's going to monitor the comments a little bit for the start of this video. So if you guys have any questions about that nursing side, great time to ask them down in the comments, and we'll try to get those answered for you.
And there's a lot of resources out there too. There's Facebook pages dedicated to providers that want to go into flight, or other resources for folks trying to pick a career path, into nursing or paramedicine. This is just a little bit of my perspective, and my story is different than a lot of people's, but.
Absolutely. Yeah, so I'll try to link some of those down below for you guys to check out for kind of that path and some of the resources that you can recommend to me there. Like I said, you have questions, leave them down below, and I will see you next week.